Secretary has announced an urgent review into racial bias in medical devices following a study that found that oxygen level readers in hospitals are less accurate on people with darker skin.
The British Medical Association has now told this programme that the medical world is designed for a white population. We'll be speaking to some guests on this very soon, including the chair of the BMA, but Dr Hilary is with us. Hilary, I mean, is this a real concern? Because, look, I lost two relatives in COVID. I lost an uncle at the very beginning, in April, you know, and we lost a cousin in February of this year. And it really pains me to think that actually could their life have been saved if the medical devices, oximeters or whatever else they were using, were more suited to them. And it's a real... I think a lot of people will be a real concern because we know there's been a disproportionate number of deaths of black and Asian.
Absolutely. Yeah. Let's start at the beginning. What is an oximeter? An oximeter is a little device which clips on the fingertip, and you can use these at home, you can use these in an ambulance, you use them in hospitals all the time. And what it does is it shines a beam of light through the skin. So it's logical that pigmentation in the skin could affect the absorption of that light and make the reading of oxygen levels in the blood less accurate. Now, we know that people with black skin are 3 times more likely to have a slightly inaccurate reading. You know, it's not a massively inaccurate reading, but it's less accurate. So it could say that you think you've got more oxygen in your blood than you really have. So it could contribute to people thinking, a bit complacent, you're OK. But look, it's one modality of things that we measure. A bit like blood pressure. You don't rely on one reading, you rely on serial readings. Are they getting worse? That's much more significant than the one reading. So you look at this, you become aware of the fact these devices are not 100% reliable, and you look at other things. How do you feel? What are the symptoms like? So it is a problem that devices need to be recalibrated for people of different skin, but I don't think it's a sign that the NHS is institutionally guilty of racism or anything like that. I think it's just that, you know, some tests are less reliable in some people than others, and we need to be aware of that.
All right. Well, to discuss this, we're joined by Dr Chang Nagpaul, GP and chair of the British Medical Association, and Dr Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School. Let's first come to you, Dr Nagpaul. I mean, what do you think? I mean, we're not talking about institutional racism, although there's intentional of racism, are we, in the medical profession? We're talking about racial bias that has just come from behaviour and norms and perhaps taking the eye off the ball, maybe, a little bit?
Yes, I agree. I mean, this is not intentional. What this reflects is that a lack of consideration of ethnic diversity at the development and research when medical devices are created. So what we found here is that after the event, that the monitors for blood oxygen levels overestimated the readings for people with darker skin, and that can have, you know, serious consequences because decisions are made around patients who are critically ill on the levels of their oxygenation. So what we're calling for is that when we have devices developed, there needs to be proper research and proper assessment of people from different and diverse races and ethnic backgrounds. The same applies for drugs. You know, there are some drugs that do not work as well in patients with of certain races. You know, common drugs for blood pressure, for example, we've since found do not work for some Afro-Caribbean patients, drugs called ACE inhibitors. Again, the research seems to be not ethnically diverse. So what we're calling for is starting off recognizing that the world is made up of people from different ethnicities, different skin colors, different races, and you should do research that's based upon encompassing all of those. And that applies even to medical education. We're taught how to treat patients with skin disorders on white skins. The textbooks that I grew up with, the learning materials out there, do not show ethnically diverse training material.
Dr Bharat Pankhania, your senior clinical lecturer at the Exeter University Medical School, it must have come as a shock to many people when asked, had people died of COVID as a result of this failure of the oximeters to, you know, take account of the different colour of skin, that Sajid Javid said, I think possibly yes. I mean, a simple piece of equipment with a life-saving value that wouldn't have worked in some cases. That's devastating, isn't it?
Well, you would never treat a patient just on a reading. So look, let's have another example. Just because an ECG is flat-lining, meaning a straight line, no cardiac activity, and that doesn't mean the patient is dead. You need to look at the patient. The cables might have just come off. So similarly, here with the pulse oximeter, it is not a case of you're looking at the patient and reading it, but not looking at the patient and assessing the patient's health and well-being. So really, the issue is, it is an oversight that the pulse oximeters were created and they are mass-produced. And when these items are mass-produced, they're mass-produced for an average skin color. And of course, when you want to make things cheap and readily available in their millions, you are unlikely to make a pulse oximeter calibrated for darker skin, lighter skin, and in between. So these are issues. These are issues of mass production and trying to get the greatest items cheaply onto the market. I don't think this is a racial bias issue. It is an overlooked issue rather than, we were purposefully negligent or not looking into it. And I completely disagree that lives would have been lost just because the pulse oximeter was giving the wrong reading. Because your assessment always has to be, look at the patient. How is the patient performing?
Yes, and Dr Chang Nagpaul, the Health Secretary has now announced a review into racial bias in things like the oximeters. Do you think that that will reassure people in this case?
So what I think is that we need to do a review much more widely than just devices. As I said earlier, we need to make sure that when you have drugs developed, when you have devices developed, there is a proper inclusion of all ethnic types. Even PPE during the pandemic, the tight-fitting FFP3 masks that require a tight seal were designed more for white faces. We had and also we had gender issues. They weren't fitting women and some ethnic minorities as well, which is an issue. Even in fact, I'm a GP. We manage patients and we rely on blood results. There are some blood results that are different for people with ethnic minorities, and we misinterpret them. We could misinterpret them. So what I think is this is a much wider issue, and what the Health Secretary should be doing is broadening this review to look at the way in which we, as a medical profession, have the right resources that are developed, the right information that allows us to recognize that people do have differences in terms of their ethnic or race origins, and the way we treat them, therefore, needs to be tailored for their needs. Okay. And that means effectively ethnically competent medical research and management.
Dr Nagpaul, just very quickly, they're also looking at gender as well, aren't they? So I did read that there's an issue with like MRI machines, that if you're a pregnant woman or breastfeeding, you can't use an MRI machine. So this review will also look at gender bias as well, I believe. Can you hear me? Dr Nagpaul, have you lost me? Are you there?
Oh, sorry, I can hear you.
Yeah.
Was it Dr Pankhania? Would you like me
to you, sorry, to you. Are you aware? Is this going to be part of the review,
yes,
that they're going to look at gender bias as well?
Absolutely, and there are issues around gender bias. In fact, and not just gender and ethnicity. For example, black women are 4 times more likely to die during pregnancy and following childbirth than white women. So there is a need to make sure that we look at diversity in its most diverse context, looking both at race and ethnicity, but also gender as well.
Okay.
All right. Thanks all very much indeed for your time this morning.